Intracapsular tonsillectomy. What are tonsils and what problems can they cause? What are tonsils? Tonsils are glands. They sit at the back of the throat. There is one on the left and one on the right. They help fight germs and infections. Does my child need tonsils? Tonsils are important to fight germs when you are a young child. After the age of 3, they become less important. You can still fight germs without tonsils. The tonsils may need to be removed if they are making you poorly. What problems can tonsils cause? Tonsillitis, quinsy, sleep-related breathing disorder. What is tonsillitis? Tonsillitis is an infection of the tonsils. The picture shows large red tonsils covered in white spots. It can be caused by a virus or bacteria. Tonsillitis can give you a high temperature, a sore throat, swollen glands in the neck, pain when swallowing. Your child feels very tired and unwell for 3 to 4 days. Some children miss a lot of school when they have a lot of tonsillitis. How do you treat tonsillitis? Tonsillitis caused by a virus is treated with painkillers and lots of rest. Saltwater mouth rinses can make tonsillitis less painful and reduce how often your child gets it. Some young children find mouth rinses difficult. Tonsillitis caused by bacteria is treated with antibiotics. Painkillers and lots of rest are important too. Too many courses of antibiotics can cause other problems. What is a quinsy? Pus can collect next to the infected tonsil. This is called a quinsy. It can cause a high temperature and a very sore throat. Usually, one side feels worse than the other. Your child may find it hard to open their mouth. The pus will need to be removed to get relief. This can be done under local anesthetic in older children. Local anesthetic is a medicine that makes one spot on your body sleepy. This will stop you feeling any pain. Younger children will need to be asleep under general anesthetic. General anesthetic is a type of medicine that makes your whole body go to sleep. You have this during operations. The tonsils are cut, and the pus is drained while your child is asleep. Your child will also be given painkillers and antibiotics. What is sleep-related breathing disorder? Sleep-related breathing disorder. Large tonsils can cause snoring. It can also cause breathing pauses when your child sleeps. It may sound like your child has stopped breathing for a few seconds. It can make your child feel very tired during the day. What if my child has a lot of problems with their tonsils? Your child might need an operation called tonsillectomy. Intracapsular tonsillectomy. What can we try before an operation? What are the alternative treatments? Sometimes, tonsillitis is treated with painkillers. Your child will need lots of rest. Saltwater mouth rinses can help. This can make tonsillitis less painful and reduce how often your child gets it. Some young children find mouth rinses difficult to do. Some types of tonsillitis are treated with antibiotics. Painkillers and lots of rest are important too. Too many courses of antibiotics can cause other problems. You can wait and see if the problem gets better by itself. Children often grow out of the problem over a year or so. What if my child has a lot of problems with their tonsils? Your child might need an operation called tonsillectomy. Intracapsular tonsillectomy, the operation. What is a tonsillectomy? This is an operation to remove the tonsils. It is a very common operation. Your child must have a lot of bad sore throats, quinsy, or trouble sleeping to have this operation. There must be more benefits for having the operation than the common risks. What is intracapsular tonsillectomy? Tonsils are surrounded by a thin layer of tissue called a capsule. Intracapsular tonsillectomy uses a heat wand to remove the tonsil but leaves the capsule in place. What is the alternative option? Your child could have an extracapsular tonsillectomy. This is the traditional way of removing the tonsils. This operation removes both the tonsil and the capsule. Why choose intracapsular tonsillectomy? The doctor will explain the best treatment for your child. Intracapsular tonsillectomy has a much lower risk of bleeding. Before your child's operation, arrange for 2 weeks off school or nursery. You must tell us if your child gets unusual bleeding or bruising. Also, tell us if other family members have this type of problem. Please tell the ENT specialist and anesthetist if your child has any loose, capped, or crowned teeth. Let the ENT specialist know if your child has a cold or a sore throat in the week before the operation. If this is the case, it will be safer to delay the operation. What happens during the operation? Your child will be asleep under a general anesthetic. General anesthetic is a type of medicine that makes your whole body go to sleep. You have this during operations. A tonsillectomy is performed through the mouth. There are no outside cuts or scars. The operation usually takes about 30 to 60 minutes. Your child will then be taken to a recovery area after the operation. They will be carefully watched while they wake up. They will be away from the ward for about an hour. Intracapsular tonsillectomy, what to expect after the operation? What happens after the operation? After the operation, when the anesthetic has worn off, your child will go to the recovery ward. Most surgery is done as a day case. This means your child can go home on the same day of operation. Some children may need to stay the night in hospital and go home the next day. What symptoms should I expect after the operation? Sore throat. Your child's throat will be sore. This may get worse 3 to 5 days after the operation. It will slowly get better. Give your child painkillers 30 minutes before meals for the first few days. Do not give more than it says on the label. Do not give your child aspirin. Aspirin is not safe for children under 16 at any time unless prescribed by a doctor. Sore ears. Your child may have sore ears. This is normal. Having sore ears does not always mean your child has an ear infection. Bad breath. Bad breath is very common after tonsillectomy. Having bad breath does not always mean your child has an infection. Drinking lots of water and chewing gum can help. Feeling sick. Some children feel sick after the operation, but not for long. Your child may need some medicine for this. Swollen uvula. The dangling bit at the back of your child's throat can swell up after the operation. This can feel like there is something stuck at the back of the throat. It gets better within a few days. It does not usually need medicine. High temperature. Your child may have a high temperature in the first day or two after the operation. This is common. Half of patients may get this. A temperature that quickly goes back to normal should not need antibiotics. Can my child eat and drink as normal? Yes. Your child must keep drinking lots of fluids after the operation. They must be able to eat and drink before they can go home. Give your child painkillers 30 minutes before eating to help with pain. Eating and drinking normally will help clean the back of the throat. Eating and drinking normally makes bleeding and infection less likely. If your child does not eat and drink, they may become dehydrated. How long will my child be in hospital? Your hospital usually aims to do your child's tonsillectomy as a day case. This means your child will be able to go home on the day of the operation. Some children may need to stay in hospital for one night. This may depend on the age of your child and if they have any other health problems. Please discuss this with your child's specialist. Your child can only go home when they are eating and drinking and feel better. How long will my child be off school? Keep your child off school for 10 to 14 days. Make sure they rest at home away from crowds and smoky places. Your child should not do any hard exercise for 2 weeks to help the throat heal. When the throat is healing, your child can pick up an infection more easily. Keep them away from people with coughs or colds. Can my child brush their teeth? Yes. Your child should brush their teeth to help keep their mouth clean. Will my child need a follow-up appointment? Your child's doctor will tell you before you go home if you need an appointment. Intracapsular tonsillectomy, risks of the operation. What are the risks of a tonsillectomy? Tonsil operation is usually very safe. However, every operation has some risks. Risks fall into the following groups. Bleeding. The most serious problem after a tonsillectomy is bleeding. Intracapsular tonsillectomy has a much lower risk of bleeding than other types of tonsillectomy. Bleeding affects 2 out of 1,000 children having this operation. A very small number of these will need a second operation to stop the bleeding. If your child spits, vomits, or coughs up bright red blood or clots, take them to the emergency department right away. Infection. Some children get a throat infection in the first 2 weeks after the operation. This usually happens if they have not been eating properly. You may notice a high temperature, 38 degrees Celsius / 100 degrees Fahrenheit or above, that does not go down, and a bad smell from your child's throat. Damage to teeth, lips, and gums. Your child's mouth is kept open during the operation with an instrument. This sits on the teeth. It is not common to damage, break, or lose a tooth. Sometimes a small amount of the tonsil may be left behind. Sometimes this may grow back. This means previous tonsil problems may come back. Around 2 in 100 children will need a second operation to remove this if it causes problems. General anesthetic. The operation takes place under general anesthetic. Your child will be asleep during the operation. This is very safe for children. You will be told about the risks of a general anesthetic. Who do I contact if there are problems? Please contact the day surgery unit or your GP if your child has the following problems. Difficulty swallowing liquids. Painkillers do not help with their pain. A high temperature that does not go down. Go straight to your nearest emergency department if your child has any of the following. Difficulty breathing. Spitting out bright red blood or clots. Vomiting bright red, black, or brown vomit. This could be blood and needs to be checked.